And okay, welcome everybody to today's webinar. My name is Layla Moomin and I am the Community Engagement Coordinator for the Canadian Cancer Survivor Network. Thank you everyone for attending the second webinar in our 8-part empowerment series entitled CCSN's Remarkable Cancer Survivors Guide to Getting the Best of Conventional and Complementary Medicine. If you weren't able to attend the first webinar in the series, you can always find recordings of it as well as the slides on our website at www.survivornet.ca. We are pleased to welcome our presenter for the webinar series, Dr. Rob Rutledge, who is a radiation oncologist based in Halifax, Nova Scotia, and specializing in breast, prostate, and pediatric cancers. He is also an associate professor in the Faculty of Medicine at Dalhousie University. In this webinar, he will be providing an overview of cancer, its treatment, and how to get the best medical care in this empowering presentation. He follows with practical advice about diverse complementary treatments and techniques and how to integrate them into your healing journey. At the end of the presentation, our speaker will answer any of your questions. However, at any time during the webinar, please feel free to type in any questions you might have into the chat box. For those of you who have not attended an earlier webinar with us, the Canadian Cancer Survivor Network is an organization working with cancer patients and survivors to learn about health system complexities, connect with others to plan action, and act to promote best care and healthier survivorship. If you would like to learn more about CCSN, please visit our website. This webinar is being recorded and it will be available tomorrow on YouTube. In addition, the slides will be available on SlideShare. Links to both will be sent to the email you provided. I will now turn things over to our presenter. Welcome, Dr. Rutledge.
Thanks, Layla, and welcome everybody who's attending now and who will listen to this presentation. First of all, hats off to you. I really think taking the time and empowering yourself can make a huge difference in your health. And it's just that kind of meta message that your health is coming first and you want to get stronger, you want to recover, you want to heal in your life. And I think you can have a really powerful influence on that. So I'm going to launch the slides and hopefully you can see my little head presenting in the background here as well. Does that work for you, Layla? Yeah.
Yeah, perfect.
Great. So, so thank you to Canadian Cancer Survivors Network. It's a wonderful collaboration with the charity that I lead called the Healing and Cancer Foundation, healingandcancer.org. And I'm excited to give this talk partly because, you know, you really can make a difference and people are very interested in this topic. And I want to provide a kind of oncologist, scientific, logical perspective around this, recognizing that each and every one of you can be guided by your own inner wisdom and following a path that feels right for you. And I always say it's use the two wings of the bird. So one is the rational, logic, scientific mind. Get the information that's, you know, in terms of your decisions, and then trust that inner wisdom. That's the other wing of the bird in order to really give yourself the best chance of recovery and healing in the long term. So what do we think about in terms of your goals for this series? So this is an 8-part series. And you may fit into one or multiple of these categories: maximizing your chance of recovery, right? Or longevity, if that's what it's going to be. By empowering yourself, you can feel better emotionally and just, you know, let go of the things you can't control, focus your energy on the things you can control. And that can put you into that kind of emotionally stronger space. I'd like you to be able to function better. So to think more clearly and be able to have more energy to do the things you love to do. What's this all about? Why do we do these things? Because it's important to connect with other people. Your relationships are super important, right? So we connect more deeply when we take care of ourselves. And lastly, there's always this opportunity of growing psychologically and spiritually. And so you do these things, you get the best of the medical system, you follow the complementary treatments that are right for you, do all those things to ultimately achieve your goals, whatever those highest goals are. I'm really following a lead. I mean, it's actually more like a 30-year story. Most recently, it's been around Kelly Turner's book, Radical Remission. And really, Kelly interviewed hundreds of people who have undergone a spontaneous remission. And she looked at the attributes, attitudes, actions of those survivors. And so I'm trying to use her kind of qualitative research to provide you with a way, a mechanism, a path that really helps you heal in your journey, whatever that path is. And so I've been very, very interested in this whole topic of what you can do to really make a difference in your life. And so I'm tapping into her teachings. Now you'll see that there are 9 factors. In fact, I should have put the 10th factor on there. So most recently she updated that to say the remarkable cancer survivors also exercise. They physically push their body a little bit each day in order to get stronger and have all those positive influences. And we'll talk about that part of it in a subsequent webinar. But you can see there that 2 of these are a radical change in diet, right? So, and you may have a fantastic diet to start out with, but people take the time, the remarkable survivors take the time to make sure the diet's the right diet. And again, I'm going to spend a whole webinar just on diet. Because it's so important. So I'm going to bypass the dietary part of it today, saying, that's a whole topic by itself. She also said they use herbs and supplements. Now I want to qualify this because there was no common herb or supplement, right? So there's no shark cartilage, there's no ginseng, there's no essiac, there's nothing that was common amongst them. And I actually think that the reason here they're using herbs and supplements is actually a corollary or correlated with taking control of your health, right? So I'm not one to push herbs and supplements because we're going to talk about the pros and cons of that. It's more like you're willing to do the things you need to do to take care of yourself. And so that proactive approach, that setting the intention for healing is actually coming out as a change in behavior in these folks. Okay, so take home points. What do remarkable cancer survivors do? 1, they integrate the best of conventional care, and I would call it complementary, but I also put that kind of healthy habits complementary care there. If they're taking complementary care, then what I would suggest to you or to them is that they do their research and trust their inner wisdom. So the 2 wings of the bird. And lastly, the takeaway is that you can have a profound influence on your health and the happiness. To really, I'm talking about this from a kind of scientific meta perspective, but you as an individual are not a statistic. You're a person, and therefore you can always do better than anybody says. So also take that with a grain of sand. So what are we going to talk about? So I want to go over the basics of cancer and just kind of conventional treatment so we can put that within context. I think that was important as well, is because you can then understand how these other healthy habits and complex techniques actually influence cell growth. So I want to go there. I want to give you some practical advice about getting the best from the conventional system. We're going to talk about complementary alternative medicine in kind of pros and cons and how to do that. And then ultimately, I do want you walking away saying, I need to do these things as my base, my foundational piece, in addition to whatever else I'm interested in doing. So let's start just with the space. What is cancer and its treatments? And from kind of how cells are made all the way through to the treatments. So what is cancer? Cancer occurs when the normal cells in your body start to grow in an uncontrolled way. Lots of different types of cancer. They all kind of get started in a certain part of the body, which is how the cancer is named. So even if it's spread from breast to bone, it's still a breast cancer, for instance. The other one to take away is that each person's cancer is completely unique. You cannot compare yourself with anybody else, and therefore you can always do better than anybody expects of you as well. So normal cells. So our body has like 1 trillion cells in it, and each of those cells has this kind of purpose, right? Red cells, platelets, white cells, et cetera, et cetera. Most of those cells are actually pretty quiet and they're not dividing. So those aren't the cells that turn into cancer. It's the cells that continue to replicate with time. They're greater at risk. The cells communicate with each other. So there's kind of a good social system there. Basics are, if you look at individual cell, think of it as a tiny potato or a little balloon. And I like this idea because then you can visualization of actually what a cell looks like. Inside of the cell is the instruction manual. And I think of it as words and sentences. And so that's the DNA or the chromosomes, the genetics, right? But it's the words and sentences that tell the cell what to do. How are cells replaced? Obviously, some cells are dying all the time, whether it's your intestinal tract or your mouth or your skin. There's certain cells that continue to grow all the time. So there's wear and tear and die, and the dying cells are replaced by cells, the cells that divide. So when a cell divides, essentially the parent splits into two daughter cells. The daughter cells have exactly the same control center, the same book of instructions as the parent. So essentially you're inheriting, your genetics from the previous generation of cells. Obviously, in the normal growth state, the number that die equal the number that are born, so to speak. It's actually, if you have to get yourself, if you had a cut in your skin, you have to grow some skin cells more quickly, and those cells replicate quickly, and then they stop growing quickly, right? So it's controlled through and through. So then how are cancer cells made? It's a normal cell that has multiple mistakes. So this is this idea that's genetic, or it's the words and sentences inside of the cancer cell that has those dozens of mistakes. And those dozens of mistakes could be caused by genetic abnormalities. So you're born with lots of mistakes. It's less than 5% of all cancer. So that's really not an issue. The more common one is that as the cells replicate over over your decades of life, they have particular damage as they try to go from the parent cell to the daughter cell. That's called a mutation. And we definitely speed that up when some type of substance within the body causes damage to the cell. So that's called a carcinogen. So whether it's toxins in the diet or super fatty diet or viruses, different kind of chemicals within the system, sunlight can cause these cells to become abnormal. I also want to recognize that there are something called epigenetics I'm going to get to in a second. So I want to give you an example of how the instructions of the cell can become abnormal. So if the normal instruction was the cells are dividing along and they run into the lining of the prostate gland, they would get a signal to say, stop dividing there. So right, they're listening to their bodies. They don't have to divide any further. If that instruction is changed to keep on dividing after coming in contact with the lining of the prostate, then that would be an example where there's kind of no breaking in the system. The cells will keep on turning over because they're not accepting the break signal. Another example is this idea of the hormones and receptors. So you're imagining again the cell as a potato and this little antenna on the outside edge. That outside edge of the cell is getting signals from the surrounding environment. And so the normal instruction might be something like divide only if hormone X is on the receptor. If that gets changed to divide if hormone X, Y, or Z is on the receptor, and when hormones Y and Z happen to be around, they'll give the cell a prime to turn over to kind of keep on growing. And so I think about that as having the gas on the gas pedal. So it's continuing to kind of push the abnormal dividing. So why don't we see more cancers? Because the system continues to kind of clean up those mistakes. Oftentimes the mistakes are in cells that aren't dividing. And if it hits an unimportant word or sentence within the cell, that doesn't kind of cause the cancer. But once you have a mistake in those cells and the cells keep on passing those mistakes down the generations, then those cells are at risk of having more problems. So the one mistake has happened. So what is cancer? It's the normal cell that's began to grow in a fast and uncontrolled way. It really requires dozens of genetic changes. So it's just not like a one hit and you have a cancer. It's changes over and over time. Cancer by definition, the kind of malignant cancer can penetrate into the surrounding tissue, or it gets into the little lymphatic channels or the blood vessels, and those cells kind of break off and float and land at some point in space and start to grow a little colony. That's called metastasis. So I show you this diagram. Think of this as happening over over decades. So the normal cells, you know, you're in your teens and 20s, and slowly as those cells are turning over, they're getting some damage, getting some more damage. Ultimately, you get enough damage that you create a tumor or a lump of cancer. And that tumor can continue to grow and change and get worse over time and spread elsewhere in the body and all the things that metastasis can do. So that's the possibility of the kind of ongoing transformation here. And this is just a graph to show when do women get breast cancer. You can see by their age, it's usually 40s, 50s, 60s, 70s. It's because they've had all that damage for all those decades in order to have enough changes so that when they're older, that's when the cancers come out. Precancerous versus benign. Precancer just means there's several changes in the cancer cell, and it has the potential, if it keeps on changing, to turn cancerous. And benign is usually a tumor that grows on the spot, doesn't have the kind of capacity to kind of penetrate into tissue or grow elsewhere in the body, kind of stays in place. And there are some benign tumors, like in the middle of the brain, that are, you know, quite serious. Okay, so then how does a tumor grow? A tumor is a lump, essentially. It's a collection of cancer cells. And so you can imagine one cell becoming 2 to 4 to 8 and so on. In the meantime, some of those cells are dying off, right? And so if you're getting more growth or more cells coming on board than die, then you actually get a growth there. And typically the doubling time, the amount of time it takes to go, for instance, from 1 centimeter to 2 centimeters of a lump of cancer is usually 3 to 6 to 12 months. So it's over a long period of time. But even in the tip of my pinky, 1 centimeter in size is 1 billion cells, which gives you an idea as to how incredibly tiny the cells are. So really important principle. So one of the takeaways from this one today is don't let slow growing cancer cells, if they happen to be in your body, to turn into fast growing cancer cells, right? So it's damage to the normal cells that causes them to turn into cancer cells. And then it's further damage to the slow growing cells that cause them to become fast growing cells, cancer cells, or the ability to spread, et cetera, et cetera. You want to turn off that pathway. So what's good for reducing your risk for cancer is also good for what you get of a cancer diagnosis. So for instance, if you have a breast cancer, you know drinking alcohol puts you at risk of having a breast cancer, then you want to reduce your alcohol consumption after diagnosis. So look at your own cancer, figure out what the risk activities are that cause or contribute to the cancer and stop those. And then also, if something like exercise is helpful in prevention, it's also helpful once you get the diagnosis. Okay, so then I've talked about this from a simply what I call a genetics point of view, like all the words and sentences inside the cell, but it's the whole environment, it's the soup around the cancer cells that actually contribute to cancer growth. And so what I say is change your soup to a healthier soup. So those chemicals can prime the cancer cells to grow. And we can also think about inflammation is also like, think about irritation. If you get irritation in your gut from eating bad food, it sends chemicals out to the rest of your body. It can cause further irritation and damage to the cells. If you get a sunburn, for instance, or you get the flu, for instance, when you get that inflammation of the tissue, it sends chemicals to the rest of your body to say, I'm sick, I need some rest. So again, it's inflammation that we want to decrease with time. So change the soup. That's why antioxidants, we'll talk about that through the dietary part, they mop up those damaging chemicals. So it's one of the benefits of eating your fruits and vegetables. And also there's this whole idea of choosing an anti-inflammatory diet. Or anti-inflammatory diet amongst other things, but anti-inflammatory lifestyle. So exercise, meditation, stress reduction, you're decreasing that inflammation within the body. So you're decreasing the kind of damage and irritation of the cells with time. So change the soup to a healthy soup. Okay, so then how do cancer cells cause problems? So you think about it, if you have a lump of cancer at the primary site where it started, you think about that growing with time, or if it gets into the lymph nodes or spreads elsewhere in the body, and that lump can either press on a nerve or it can kind of break down and bleed, into the bladder or into the kidney or that type of thing, can block a tube, like a kidney tube or a lung tube. It can slow down an organ if there's enough cancer kind of stopping the normal cells from doing their job. So that's a very practical way to think about it. And then obviously if you have a cancer in your body and you're kind of having to feed this fast growing cell, you can have fatigue. There's blood system problems, right? So the red cells, which help them with energy and oxygenation, the white cells that fight off infection, the platelets that help help with clotting and so on. So those blood system problems can happen. But ultimately, from a conventional medical system, what we're trying to do is go in and kill or neutralize cancer cells. And oftentimes it's identifying the faster growing cells as the target. Takeaway again, each person's cancer is different. Each one person has a different cancer with a different set of mistakes, and so therefore a different personality. And you can't compare yourself with others. You can always do better than you are expected to do, right? So that's the truth of it all. You're not a statistic, you're a person. I also think about the cancer cells being fragile in some way. So if we can just make a few more changes, hit the right kind of damaging button through a treatment, you can incapacitate the cell. It's only a tiny percentage of cancer cells that have the capacity to continue to grow. And so therefore we hit that side. Tumors outgrow themselves. And what we're trying to do, even just kind of in a control state, is get enough shrinkage compared with growth, and you kind of maintain yourself in status. So, and ultimately, you can also boost your immune system, which has the capacity to kill off cancer cells, right? And so I've used that as, for instance, a white blood cell will see the cancer cell as abnormal enough to identify it as kind of foreign, and the white cells, in certain tumors especially, can really have a difference in terms of fighting off and killing off cancer cells. Okay, so that's the big capacity. Big picture is they're the cells, they're growing. We're trying to either kill them, neutralize them, get them to stop growing so quickly, and definitely don't prime them to get more aggressive with time. So making a diagnosis, right? Usually people present either with a symptom, they got a lump or a pain, or it's some type of screening test like a mammogram or a PSA and so on. And so that identifies, oh, there's potentially a problem. The biopsies, they stick a needle into it, look at that sample underneath the microscope, and that tells the type of cancer. Oftentimes it looks at, how fast growing it is, et cetera, et cetera. But it starts a process. As soon as you get that first biopsy, boom, you got cancer, then that starts the whole medical system, looking to figure out what we need to do next. And I'm just giving you a little picture there of cancer cells. You can see that they're quite different. It's what they call heterogeneous, right? So lots of different types of cells there within the same cancer area. So staging of the cancer, we're trying to figure out how aggressive this is. Has it spread from the primary site to the lymph nodes to distant sites? And then that's part of what they call staging, was trying to figure out what's the best treatment for that situation. And then that also helps with what they call the prognosis, or what's the likely outcome, what's the expected result in the circumstance. And then there's lots of different tests, right? From blood tests that look, could actually measure some chemical that the cancer releases called a serum marker, looks at the function of the organs. But then the x-rays and CAT scan, bone scan, PET scan, they inject a radioactive glucose, essentially radioactive sugar. Because cancer cells are turning over more quickly, they can actually be picked up by a PET scan more easily. That's what the PET scan picks up, is kind of activity. Now, if we injected radioactive cholesterol, you'd also get the same thing. So it's not like cancer cells feed on sugar, but that's a whole other topic for the dietary piece. But there's the MRI scan, which also gives just a much more precise inner view. So there's these imaging, and then the grade is how fast the cancer cells look like they're growing under the microscope. And then there's also the receptors, which are these little antennae on the outside edge of the cancer cell. So again, for certain hormone related cancer cells. And then genetics, the more and more we're looking at what are the genes, what are the mistakes in the chromosomes that this particular cancer cell has, and does it need a particular type of targeted therapy to go after that gene. So again, it's getting more and more precise, and more like billions of dollars of research every year going into cancer and getting the treatments more effective and less toxic. Okay, I'm using this. Imagine that this is a bone in your arm or your leg, and they're just doing a kind of cross section. So kind of cut across it like a loaf of bread. If it's just an individual cancer cell there, there's no test that's going to show that cell. It's like flying over a forest and wondering if there's a blue jay in the trees. You just don't have the precision, right? So I tell you that because a normal cell, a normal scan could have some cancer cells in it. So what does the doctor trying to figure out? So when you get this diagnosis and you're in to see the specialist, they're basically they're asking themselves the big questions. How advanced is the cancer or the stage? Is the patient in a curable category? Are we trying to go for a home run, willing to do lots of strong treatments to try to go for cure? Or is it one of those that's unexpected to go for cure, but we can go for longevity? Next is, okay, so given that, what's the best treatment? What are the options in terms of treatment? And the physicians need to do all those options for you. How fit is that person? Can they get through the treatment? And then obviously, what does the patient want? I mean, we don't do anything without the permission of the patient. Okay, so then when I say cured, I mean the last cancer cell has been eradicated, the last cancer cell is out of the body, right? And so the cancer never comes back. You live, to age 95 and you die of a heart attack. So that would be someone who's cured of cancer. When you hear about adjuvant, it means an extra treatment. So for instance, a person has a surgery and then they have adjuvant chemotherapy, have that extra chemotherapy, because there's a chance there could be some cancer cells left over and the chemo can sterilize those cells. It bumps up the probability that the person's going to be cured of their cancer. When I hear it, and people may have different ways of defining this, when I hear in remission, it means that there are still cancer cells in the body, but they're not obvious. There's no scan or test that you can look to find those cells. So that person's in remission, and it's possible for that person to do well for many years and have great quality of life. The physician's always thinking about the same question. If we treat, it has to be that the benefits or the probability of the benefits are greater than the risks or side effects. So they're not going to recommend anything to you unless they feel comfortable that the benefits outweigh the risks. In surgery, obviously, if you have a lump somewhere, the surgeon's going to cut it out, right? And there's always this issue of going through the surgery itself, and then also there could be damage to the normal tissue around the surgical site. Most cases, there are some cancers that are such low risk, the surgeon can say to you, you've been cured with that surgery. But there are most cancers, I'd say, that even if the surgery goes perfectly well and the surgeon says, I got it all and you're going to do great and all that stuff, I guess there is a chance that there could be some cancer cells left over. Now, if there's a high enough chance, usually the surgeon will ask you to see the chemotherapy doctor or the radiation oncologist, or the medical oncologist or the radiation oncologist in that circumstance. Just briefly touching on this idea of chemotherapy. So imagine like the IV going into the vein. So therefore the chemo is going everywhere in the body, or the chemo pill. It's given by medical oncologist, again, meant to kill off cancer cells, given in courses, or can be kind of an ongoing basis. The issue around kind of standard chemotherapy is it usually is hitting the faster growing cells. So not only you're killing off some cancer cells, but maybe it's the fast cells that are going in your mouth, through your GI tract, or your hair cells, or, there are lots of different cells that might be irritated by this. And what we're going to talk about is just there's some targeted therapies, so there are fewer side effects. Each type of chemotherapy is different. Each person tolerates the chemotherapy differently. So even though the physician can say, typically this is what happens to you, there's obviously a spectrum from some people that just fly right through it to some people who are quite, affected by chemo, and they have to kind of change the chemo that's there. Your physician, your oncologist would monitor that, and then they would change it. So it's like given a course or two at a time, they monitor it with a time. So specific side effects for each type of chemo. Chemotherapy also has whole body effects, right? Because multiple cells are affected at different sites. Again, that fatigue can happen if the chemotherapy is irritating enough to the brain or the gut, can cause nausea, but oftentimes the nausea medication is very good. And so that's not really an issue, or much less of an issue. It can be hair loss, low blood count, sore mouth, right? So you want to know what your chemotherapy does in terms of side effects. Targeted therapy, I'm giving a little picture there. She still has her hair. She's looking pretty comfortable reading her book there. So the targeted therapies are going after a particular part of the cancer cell. So it's more specific to the cancer cell. So therefore, fewer normal cells are being affected. And more you're going to see what they call chronic conditions. Cancer becomes a chronic condition, meaning because the therapies are working better and because there's more targeted therapy, then people can live for years with their cancer and not die of their cancer. Quickly, I'm going to go through radiation as well. So it's given by radiation oncologists. It's ionizing. Think of it like a wave going through the air that penetrates through the tissue and then causes damage to all of the cells. But the cancer cells are much more susceptible and the normal cells can recover more quickly. So it's ionization, can be given as external beam, which I've described here, and I'll show you some pictures, or it can be done as internal, setting the radioactivity right within the body itself. Other than fatigue, really the side effects are in the area where the radiation is done. And then you hear all these alphabet jumble mumble words like IMRT and stereotactic and gamma knife and protons, and they're all just fancy words to say, can we really focus the radiation on the tumor and really spare as much of the normal tissue as possible? So that's the idea there. This is an example of a breast cancer treatment. You can see the linear accelerator on the right side there is aiming this invisible beam through the person, goes through the normal tissue and hits the tumor there as well. So how does it work? Ultimately, the radiation causes those waves and hits the DNA, the words and sentences of the cell, makes enough damage so the cell can't survive. And then you see on the right-hand side, the chemotherapy either can hit at the target level, all the molecular pathways or the chemical pathways in the cell, or it can go right into the chromosomes and genetics that hit those chromosomes as well. So ultimately, you're damaging some part of the cell, there's mistakes, the cell can't divide, it dies or becomes dormant. Hormone therapy is a different way to do this. Some cancer cells are fed by the hormones in the bloodstream. And if you give a hormone treatment to block those hormones from feeding the cells actually die off. And so that can be given as a pill or an injection as well. There's some circumstance, like in breast cancer, it's almost as good as chemo, if not better than chemotherapy in circumstances in terms of increasing cure rates. Prostate cancer also increases cure rates. But obviously, as you change an anti-hormone treatment, which is what it really should be called, there can be hot flushes, fatigue, and 10 other side effects coming with the hormone treatment. I just want to go through radiation logistics and planning, just so you get a feel for see as to how the system works there. Just a very quick boo, because 1 in 5 of us are going to go through radiation at some point in their lifetime. So if not you, maybe a family member or friend. So from consultation, right, trying to figure out if you're going to get treated or not, treated for palliation, i.e. non-curable versus curable. And then some patients, we use an immobilization device. So kind of like a mask that holds the face or face and shoulders to the table to keep the person completely still. So in some like head and neck cancer or brain tumors, we would do that. They get a CAT scan, which is called simulation or the markings appointment, where they're getting the 3-dimensional data of the body to tailor the treatment to that person. So that's CT simulation. You see some of the red lasers there to line up, make sure the person's straight and so on. Ultimately, they have a CAT scan, and then they put little freckle-sized tattoos on the skin, like usually 5 on the skin. If there's a mask, they don't put tattoos on the mask. But anyways, you can see with that blue fingernail, it's just the dot in between the 3 lines is the actual tattoo there. We take the 3-dimensional anatomy and then we contour, outline the tumor, and we contour and outline the normal tissues. And then the planner helps the radiation oncologist kind of aim the radiation beam such that it's hitting right on the tumor itself and sparing the surrounding tissue. And there's, for instance, a distribution for breast cancer. And in the top left diagram, you can see the black is the lungs, the big lump in the middle is the heart, and you can see the colored tissue, that's where the radiation is going in. There's even a lump within the breast itself. The radiation is going to hit the breast tissue. It's going to skim across and hit some of the lung tissue. So there is a little bit of damage on the lung itself. So that's part of a breast cancer treatment. And then ultimately, it comes into the linear accelerator. So the accelerator you can see on the right side, the accelerator rotates around the person, aims the radiation into them, and they line up on those little tattoo dots to make sure the person's in the same space all the time. The person has to stay in the room by themselves, anywhere between 1 treatment and 30 plus treatments, 10 minutes per day, Monday to Friday. They get monitored, they can see and hear them. And there's ultimately the radiation treatment that I was describing earlier. And then lots of different new fancy techniques of aiming this radiation and really being precise in hitting a spot. For instance, with this person with their brain metastasis, a very small area. And that's kind of now the standard of care, is to get very, very precise with those treatments. Okay, so I'm giving you a quick boo of big picture. And now that's so kind of the big treatments, but I want to convert this into something practical. What do you need to do to get the best of that care now? And so, as I said from last time, understanding is level 1. You advocate for yourself in terms of getting the best care from the medical system. And then ultimately there's a healthy lifestyle, the body, mind, spirit stuff. And then we'll go into the complementary side, last part of this presentation. So we get information so that we can speak the language and understand. It gives you kind of feeling of control, and ultimately it allows you to make the best decision for yourself. So you really want to, either if you're not going to do it, then you want to have your loved one be the kind of medical expert for you as best as you can. And this information also gives you the background that you need, the data that you need to make decisions about the non-medical aspects of your care. So too much information. So ultimately, you can't be a physician in a short period of time, and you can just drive yourself crazy with internet searches and so on. And at some point in time, you have to be able to trust yourself and trust your team to see you're getting the right care and let go of the things you can't control. And especially if you're getting conflicting information, you want to go back to your team to get that clarified, right? So if you're reading something on the internet, but your physician's choosing a different route for you, you want to clarify, because your physician oncologist is the expert. They have the background. They can individualize the treatment and the information for your situation, right? But you can only understand, only ask the right questions if you prepare first. So how do you get that information? You go to an expert. So whether the experts, maybe they have the expertise at the cancer center through a librarian. Canadian Cancer Society has a fantastic free service at that number, or going to the website. They again tailor the information to your situation, your learning needs. The not-for-profits for your type of cancer also have good information. So what I'm trying to do is get you to stay away from the complementary experts or the non-valid, non-proven treatments, getting the information there first. So you network, connect, and learn, like going to the seminar. So how do you get the best from the healthcare system? It's recognizing when you need to advocate for yourself. So it's like having the knowledge, having the background to say, no, I need to speak up now, or no, I can't control this, I need to let this go. And that's information and understanding. You advocate and prepare by preparing for your doctor's visits, contacting your doctor or nurse if you're having questions or concerns, right? You want to keep on advocating until at least they can say to you, we don't know, and we can't know. There's nothing else we can do, but at least you've kind of exhausted that possibility. The medical system has a whole bunch of extra services that I'm going to talk about. So you need to advocate for yourself to ask for those services if you need them. And then ultimately, most of the time your physician, your oncologist is following the kind of international guidelines. But if you feel like you're not getting good care, you feel like there's been a breakdown in communication, don't trust your physician, then how do you get that second opinion? All right, so before the visit, you're bringing in your symptoms and summaries, your medications. You're preparing by writing down your list of questions, right? Because it's so easy to get nervous and agitated and not be able to concentrate that you forget to ask your questions. So have them prepared. But what I would say is let your physician do the summary first, because they usually will answer many of the questions first. You should have somebody with you and decide who's going to record that visit. So either verbally, I had a lady use her iPhone to kind of record the summary for her friend, right? So again, recording electronically or so on, and let your physician know. Lastly, I do think it's worth actually having a complete file of all your reports and so on. Legally, you're entitled to it, and you can get that by asking medical records to get you a copy of that stuff. And sometimes you'll be helpful because you will have the information that your physician or your nurse wants to be able to kind of hand it over and say, take a photocopy of it type thing, and keep the copy. Okay, so when you're there, you need to just be yourself, be open and honest. If you recognize that your doctor's talking in baffle gab, recognize that and say, sorry, doc, time out. I'm not sure I understand what you said. Can you repeat that with simpler language? So it's another technique. The summary, as I said, usually gives the majority of the questions, but then ask your questions at the end. Make sure you go through the list. I didn't, get question number 9 answered. So that way you'll feel better because you'll have those answers. It is your responsibility though. Find out what to expect, right? Are there side effects? How bad do the side effects have to be before I do something? What do I do at some? Who do I call at 3 a.m.? Right? So you want to make sure that you understand your own responsibilities, and you will get better care by taking care of yourself that way. After the doctor's visit, again, I'm suggesting that you have that journal, list of results. If you need to, bring in more family members or ask for that conference call or Zoom call with the team. If you're having problems connecting with your physician, you might ask a family member to kind of talk on your behalf. Continue to call to clarify for information. You are entitled to a second opinion. If you feel uncomfortable, so how do you do that? Talk to the nurse of the oncologist saying, I'm not feeling good here. I'm wondering if I can get a second opinion. So that's one way to go at it. Or go to your family physician and they can fax in another conduit saying that you want a second opinion. It's more important that you get the care that you want than how your doctor's ego responds to, being asked for a second opinion. So. Okay, so then there's a whole bunch of other specialists within the system, right? So I always would recommend seeing a dietitian or psychology. There's a lot of people, rehab help with fatigue or lymphedema, spiritual care. Like there's a lot of expertise there if you ask for it. They hopefully would refer you anyways, but that's one way to go at it. Social workers often a key character to help coordinate. You ask your doctor or nurse, is there somebody else in the system who can help me with this particular problem, like fatigue, for instance? Okay, I just want to say it's normal to have emotional difficulties on the cancer journey. That's the norm, the expected. And you also notice that you'll have good days and bad days, so it can be exaggerated or come unexpectedly. How do you work with this? And I'm trying to warm you up to actually get some help if you need this. Find that wise person in your life, or ask the nurse or physician for that, and be kind to yourself. And especially if you're kind of decompensating, right? So you've lost your enjoyment of life, you're feeling overly depressed, can't make a decision, can't sleep, et cetera, talk to an expert. I would really recommend that for you. How do you get that? Talk to your oncologist, schedule a visit. Sometimes they can just even call the cancer center and they can refer you on to, one of their psychosocial team there. But find an expert. I do believe in support groups, a powerful way to network, get information, really empower yourself, really make a difference there, and recognize you're not alone in the journey. Great way to express your emotions. Okay, guys, I'm 45 minutes in. I needed to stretch for a minute. So let's just give ourselves like a 15-second stretch. Oh, yeah. Look away from your computer screen. Oh, close your eyes. I'm glad I put that slide in there. Okay, even if you're listening to this after the fact, give yourself a stretch. Okay. All right, so for this last 15 or 20 minutes, I want to talk about complementary medicine. We have experts in Canada. Dr. Linda Belnies is a nurse PhD, was in Vancouver when she developed this work, but is now in University of Manitoba. Fantastic resource, has developed a whole program there, and I'll give you that website. But again, this is important because mostly oncologists, nurses, conventional medical folk are uncomfortable with this topic. They just don't have enough expertise. And so my advice for you is start with the healthy lifestyle choices, right? So if you exercise in a way that's right for you, if you change that diet to anti-inflammatory, antioxidant diet, fruits and vegetables, and really the anti-cancer diet, maintain a reasonable weight, practice good sleep hygiene, practice relaxation, do the psychological work, do those things, and this will be like 98% of the way, really. Again, do your research, trust your intuition. If you're especially taking something by mouth or IV, it's extremely important that you tell your physician what you're taking and doing, right? Because of the possibility of interaction. So that's a takeaway point from this part of the talk. I'd say don't forgo the proven treatments. The medical system is based on science, right? And so it has a great power on that side. And so your physician should be able to tell you the pros and cons of your choices. But if there's something that's potentially going to work from the conventional side, please don't give up on that side of it. Okay, so, and I just gave you the, oops, let me just go back up there. Yeah, so I just gave you the overview of adopting the healthy habits. So what is complementary and alternative medicine? CAM, you're going to hear me talk about CAM from now on. So it's the medical and healthcare system practices products that are not presently provided in the conventional medical system. So interestingly, probably acupuncture used to be a CAM, and now we're actually adopting it more and more because it's been proven to help in certain circumstances. And then you can see in the right bottom of the screen, they break it down into 5 major categories, including whole systems, which would be like traditional Chinese medicine or shamanic or Ayurvedic or those type of systems that I'm not going to touch on as much. Cultural systems. So complementary and alternative medicine, CAM. Complementary means you're using together conventional medicine. Alternative means you're using it in place of conventional medicine. So that's why I do not want you to go there. And integrative, I'd say it's like combining complementary and conventional, but it's based on evidence and safety, right? So it's actually kind of a more scientific, evidence-based system. So that you hear integrative, that's definitely up the alley of what I'm trying to push today. Okay, so why? Because like 4 out of 5 of us are taking some type of complementary care if they get a cancer diagnosis. There's evidence, there's more science as to what role it plays. And oftentimes we still feel uncomfortable because we just don't know what's safe and we just don't have the information around this. So everyone's kind of in the same boat on this side. And this is what the power of this presentation is. Again, I would say use what's best for you, right? We're all unique. Even though I'm giving you a particular perspective in terms of scientific paradigm, there is something that I would call metaphysical, meaning that, something that can be transcendent to the physical that has a profound influence on your health. But I will also say do the work in order to create the conditions for those things to happen. And your strategy obviously can change with time. So, and this is the warning. So where are you getting information, right? What are the goals, the reputation, the funding of the organizations that are providing the information? So that's why, the not-for-profits, the professional organizations, I think are the best sources there. Be careful of the kind of advertising stuff. You're looking for evidence, which I can show you. And be very cautious of the, we cure everything, the cure-all type of claims, or the pseudoscience, or the conspiracy, or the anecdotes, I guess, is it. So this is very important in terms of thinking about quality of evidence. So you go from kind of test tube, put some cells in there, and put in this mega dose of this particular herb, and it killed cancer cells. Well, that's not good enough evidence. Even the case reports, or even less, is just the anecdotes from the practitioner saying, I've given this to 10 people and it's helped them. Well, that's that's not scientifically based because it's not reported and reviewed. Those 10 people may have got better anyways. But as you go up higher and higher in the pyramid, you get to controlled trials and ultimately randomized trials where half of the population is getting a certain treatment, half the population is getting a different treatment. And then lastly is the systemic reviews, are looking at multiple high quality papers together. So what is the quality of the evidence? I'll always ask you that question. And this is a systematic review. So they're looking at all the best data. So Janssen in 2015, this is the takeaway. Massage, we know, helps people feel less anxious. Acupuncture really helps with chemo-related nausea, potentially, I'll tell you soon enough, hot flushes. Hypnosis improves a number of issues around quality of life. But the biologically based practice, there's no convincing evidence that actually makes a difference. Although many people will say, I feel better doing those things. It doesn't make a difference in terms of cancer outcomes is the takeaway. And this is what the National Institute of Health wrote to make it more clear at present. There is no convincing evidence that any complementary health approach is effective in curing cancer or causing it to go into remission. Again, you can disagree with me if you want to. And for you as an individual, you may have hit a home run for yourself. I really hope that could be true. But as a physician, as somebody is looking at the evidence and saying, should you be taking this particular herb? There's no proof that it actually made a difference. And in fact, as I was doing the research, it's about 10 different chemotherapy drugs that are derived quite directly from plant-related products, right? And so what's happened is the researchers in the world have looked at everything, and the therapies that work are the ones that were extracted from nature and that are used currently in the chemotherapies that we prescribed, or some of them that we prescribe. And the ones that didn't work don't work. So I think that's how I look at this. But in terms of symptom management, in terms of making you feel better and enjoy your life and connect, et cetera, there are many different types of complementary therapies that can really help you feel better, help you with side effects. So I'll endorse that part for certain. How would you start out? I'd say this slide is super important. I would start at this level. I would go to the kind of the highest level organizations with these particular websites, and then look at the individual types of CAM and see if it appeals to you, if that's what you want to pursue. But I would start at this level as the starting level. And I put the slide in again at the end because I think it's so important to get the kind of concise information to start out with. Okay. All right, in terms of recommendations and takeaways. So for instance, the body-based touch therapies, massage definitely improves anxiety and pain. They can do a certain type of massage for people who have lymphedema or swelling of the arm that helps alleviate some of that lymphedema. And then the cautionary part of it is just watching out not to irritate the tissues and not to massage hard near the cancer sites. In terms of fitness, we're gonna cover this within a different seminar itself in terms of how can you empower your body, how can you change the soup, how can you change your brain through the kind of fitness therapy. So this very powerful effect. There's different mind-body practices, and I do endorse this part of it as well. So like the visualization, setting your attention, practicing relaxation technique, the biofeedback, the prayer, those things all tap into something that can be metaphysical as well. And so this can definitely help you. And it's been proven to help with nausea and vomiting, for instance, quality of life, sleep, et cetera, et cetera. Just think about it. You're kind of rewiring your brain to be in a much more positive, compassionate, and clear thinking state by practicing a technique. So they caution against hypnosis for some people, and especially not for those who are apt to psychosis or personality disorders. Energy therapy. So this idea that we are energy bodies and that the practitioner somehow is able to soothe or smooth or help to change the flow or deficiency can actually make people feel better. So I mean, I have experience with this myself, and I believe that that can actually have a nice positive influence. I don't recommend the kind of biomagnetic therapy. I think there's no proof, and there's possible cancer risk with it. No proof it actually improves outcomes. Acupuncture comes from a traditional Chinese medicine. So that's a whole different philosophy, but essentially our bodies have the energy. There's a chi or flow, vital energy, and that the practitioner can help change the flow of that chi. And there's good data, changes the actual kind of neurochemicals, the chemicals that are in your brain, actually has an influence there. So it's remarkable that the Western science is actually picking up on what the traditional Chinese medicine has shown. And this can help with, lots of different things like nausea, hot flushes, et cetera, changing blood pressure. Quick little joke, early acupuncture, the elephant saying, "That's odd, my neck pain suddenly feels much better." Acupuncture, here it is: pain, nausea, vomiting, hot flushes, radiation-induced dry mouth. And again, they're just watching out for, low blood cells, et cetera, but big time, this is a safe procedure for certain. The rest of this presentation now is based on the biologicals. So it's the healthcare products that you have listed there, including dietary supplements or fatty acids, et cetera. It's used a lot by people, but really there's very little evidence. And this website is a Canadian website that really kind of looks at the pros and cons of each of those natural products. So when you pick up the presentation, you also get the slides for this. I suggest going to that site if you're taking any type of product there. So recommended is that you talk and figure this out before you actually consider it, and you talk to your healthcare professionals, et cetera, around this. Dietary supplements we'll talk about next time. You're asking yourself, what are the side effects? The problem is when you take something by mouth, it can have an influence in lots of different ways. And you want to do the research around potential side effects, not only interactions with your chemotherapy, but interactions with other systems within your body, with other medications you may be taking. And these are the cautions, right? Because these medications can actually interfere with how the chemotherapy or the radiation works, because they could be antioxidants. There can be hormonal effects that prime cancer cells. The blood can be thinned. The liver can be irritated, which changes the metabolism there, et cetera. So because antioxidants can mop up the free radicals that cause the death from chemo and radiation. Okay. Hormone therapy, right? So there's certain medications that can act like estrogen in the bloodstream or act like testosterone. Be careful around that. Certain types of medication can also thin the blood in some way or form. It can cause damage to the liver, right? I'm trying to scare you a little bit because you need to do your research and you need to tell your physician what you're taking if you're taking it. You think about grapefruit juice is one of them, causing a traffic jam or stopping the liver from doing its job. Should not be taking St. John's wort during chemotherapy. And typically, if you're taking this stuff, you should stop at least a week before chemo, at least a couple of days before, and at least a week afterwards as well. Lots of other potential side effects, right? Lots of other potential interactions. Who should you talk about? So this is the kind of the takeaways. You need to tell your team what you're taking if you're taking something by mouth. Even if they don't want to know, tell them what's on your medication list now. How do you select a CAN practitioner? No, I don't think you necessarily need to see or do something extra, but you're asking them, you're going to be smart about this. What's their training? What's the quality of the evidence? And they could be giving you, papers that show this and that, but oftentimes those papers do not have good quality evidence. Is there a conflict of interest? So if they're getting money off you buying stuff from them, that's a conflict of interest in my mind. What is the total cost? Who's covering it? Will they work with other healthcare providers? Be wary, be very wary if it's expensive, very expensive. They're making some type of claim that they're going to cure your cancer. They're not able to provide the evidence. They want you to stop other medication. Another one is like, there should be a plan. Like, we're going to do this for 2 months and then, reevaluate. So consider keeping a diary, your tests, as I said before. There should be a length of time, how often you're evaluated, and some summaries going there. Okay, so I finish with this slide again. I think this is such excellent data. There's now kind of big science and collaboration and looking at all the evidence coming together such that you guys can make an informed decision about what you may or may want to do in addition to what I think is part of integrative care. So I think that's it. Thank you so much. I'm imagining there might just be a few questions on this presentation. Layla, do you want to read some of those questions if they're there, if they're coming in?
Yeah, so we have a question here. In treatment of hormone-positive breast cancer, understanding anti-hormone therapy turns off the ability of cancer cells to adhere to healthy cells. Can you explain why treatment does not include monitoring of a woman's natural hormone levels?
Yeah, so that's an interesting question. And the answer is, how would we change what we're going to do, right? Because what we know is that when we give a pill that blocks the estrogen levels from the woman's body, feeding the potential cancer cells, how are we going to actually make a decision in terms of what we would do differently? So so for instance, in prostate cancer, we can monitor if the testosterone levels are going low, because the prostate cancer treatments by design are meant to get the testosterone levels low. In breast cancer, we're not trying to make the estrogen, the normal natural estrogen levels go low as much as we just put in a medication that blocks that from happening. Anyways, I probably didn't answer that one very clearly.
Okay. We have another question. What is the evidence to support ED?
Joel, do you want to retype that? I'm not sure what, or you can say it verbally, what the ED is. Sometimes I hear erectile dysfunction, but anyways.
Yeah, sorry, can you hear me?
Yeah, go ahead, Joel.
Yeah, sorry, I pressed send too quickly. Targeted immunotherapy has become a topic, and I know the Quebec government recently authorized 70 cases of it, 70 treatments for people who have not had, who are not responding to any other form of therapy.
Yeah.
I understood that prior to this year, the only way for us to get it in Quebec would have been to go to the US, and the cost was something around $500,000.
Oh, right. Yeah. They're talking about like T-cell therapy, where they're actually manipulating the immune system by kind of re-injecting it into the person so that the immune cells can fight off the cancer cells. And I'm not an expert in that because it's both kind of on the chemotherapy side and on the immunotherapy side as well. And so, and there are only some particular cancers in which that works, and it's usually blood cancers is really the idea there. Immune therapy, getting the immune system to kind of fight against your own cancer. Probably melanoma is one of the cancers where it's made a difference. Renal cell cancers or kidney cancers, also there's some data on that side. But a lot of the cancers, breast, prostate, endometrial, colon, rectal cancer, we haven't been able to kind of prime the immune system to do this yet. But I don't know the evidence is really the answer to the question.
Okay, thank you.
It doesn't look like we have any other questions at the moment, so we'll move on to wrapping things up for today. So thank you everybody for attending today's webinar. We would like to thank Dr. Rutledge and his organization, the Healing in Cancer Foundation, for collaborating with us to produce this series. This is one of many webinars we have scheduled for the fall, and all previous webinars are accessible on our website at survivornet.ca. CCSN will be hosting another webinar tomorrow at 1 p.m. Eastern Time entitled What Men Told Us Prostate Cancer Survey Results. If you have not already registered for this webinar, you may do so on our website. We will be back with this series in another 2 weeks on Wednesday, October 14th for the third webinar, Healing at the Level of the Body. Thank you so much, everyone, for attending, and have a great day.